Through this doorway, House and Senate Democratic leaders are negotiating the final details of a massive federal takeover of the American healthcare system. Republican leaders say it's time to open the doors and let the sunshine in. After 8 years and $621 million, Congress recently opened the palatial Capitol Visitor Center in order to give the American public greater access to their government. But the public isn't welcome behind closed doors, where Nancy Pelosi and Harry Reid are hammering out the final version of the Obamacare legislation. House Republican leaders like Indiana Congressman Mike Pence want to hold the president to his word, and he promised 8 times to put C-SPAN cameras in the room as health care was being crafted.
The President of the United States should keep his word to the American people, ensure the public's right to know, and bring the C-SPAN cameras into these backroom negotiations immediately. It is simply wrong for legislation that will not just affect 20% of our economy. It is simply wrong for legislation that will affect 100% of the American people for generations to come to be cobbled together behind closed doors by one party, one White House, and a group of special interests. The American people deserve a seat at the table.
Florida Congressman Vern Buchanan has drafted a resolution to bring the negotiations into the sunlight and hopes to gain enough support to force the idea to a vote. He also hopes to set a precedent.
It should just be the health care bill. I think it should be on everything. I think we've got to change the way we do business in Washington. When you only have 20% of the people that think we do a very good job, and that's on the high side, we need to change the way we do business. Sure. And that means opening it up to the people, the whole process. So I'll probably, once we get through this, we'll be looking at everything doing that, Republican or Democrat. That's just my opinion. You talk to the leaders, you talk to the leaders. But from my standpoint, the process needs to be open to the American people.
Republican leaders charged that the behind-the-scenes wrangling will lead to hidden taxes making their way into the bill before anyone knows that they're there. Michael Cannon is the Cato Institute's Director of Health Policy Studies. He says, as currently written, the bill would already cost more than its supporters claim.
We're not counting the cost of the private sector mandates. That's where the government requires you to send a check to an insurance company for health insurance, whether you want that or not. That's a tax, just as if the government forced you to send a tax to the government, and the government provided you health insurance. So when you include that cost, the cost of the private sector mandates, the cost of the legislation isn't $1 trillion, it's more like $2.5 trillion.
West Virginia Congresswoman Shelley Moore Capito argues that the bill will also drive up costs to states, which will have to pick up a larger share of Medicaid expenses.
I asked my Democrat governor to give me a frank assessment of what the Medicaid costs for West Virginia are going to be for this bill. We got the numbers back yesterday, and staggering. If the House bill were to go through, the cost to the state of West Virginia would be $725 million additional cost. This is at a time when our own state budget in West Virginia right now is looking at a $93 million deficit. They can't pay now the cost of Medicaid. An additional $700 million to a small state like West Virginia is a staggering figure.
Unless Buchanan can get 218 members of Congress to agree to his sunshine resolution, the final details of the health care bill will remain behind closed doors, likely until just before the House and Senate vote on the package. And advocates of open government will be left out in the cold. Reporting from the U.S. Capitol, Grant Bosse for New Hampshire Watchdog on WGIR.